And now I'm going to introduce Dr. Christine Brusso from the Rhode Island section of the American Congress of Obstetricians and Gynecologists.
Thank you so much, everyone, for being here today. It is so important.
Turn it on.
Is it working now?
Yeah.
Thank you so much for being here, everyone. It's so important that we prevent
Nope. Right against your mouth.
like the Republican House and Senate have proposed in their zealous efforts to repeal Obamacare. I'm speaking today as a representative of the organization, the American College of Obstetricians and Gynecologists, also known as ACOG. It's important because ACOG is considered the country's leading group of physicians that provide health care to women. And in this role, ACOG leaders attempted on numerous occasions to collaborate and provide professional and expert input into this healthcare legislation in Washington. They were either ignored or denied on every occasion. So this is clearly not about improving healthcare. You don't include the people that provide and know the importance of healthcare at the ground level. Millions of Americans, and importantly to me, American women, will lose or have significant reductions in their healthcare access and insurance coverage. Efforts to defund Planned Parenthood would leave millions of women who rely on these preventative and other services for their care. While in Washington, they're arguing over projections of how many people will lose their insurance and defending their reckless legislation. From 23 million to 22 million, I don't think it really matters. This just shows that they are numbers to them. But to me and to all of you here, these are actual people. These are us. These are our family members.
Thank you.
Yes.
And when I think, I don't care whether it's 15 or 10 or 1 million. When I think of the harm to the people who lose access, I actually think of the faces of the women that I saw today, yesterday, and the day before. I actually deal with a very vulnerable and underserved population of women who rely heavily on Medicaid, Medicaid expansion, and Planned Parenthood for their care. And I am personally offended by this legislation, as many of you should be too. As a women's healthcare provider here in Rhode Island, sadly, I've come to expect to come and stand here every year and talk about reproductive justice and the right for women to choose for their own bodies and protection of abortion services and even contraceptive services. That's become a norm for me. But I can honestly tell you, I absolutely never thought that I would be here defending a right to have access to maternity care. Access to prenatal care improves outcomes for not only the mother, but also for infant. This is absolute fact. Access to contraception has reduced unintended pregnancies and has brought teen pregnancy to a historic low. We have very effective screenings for many female cancers, and this is part of routine preventative care for women. Reducing the number of women who have access to this and other services is absolutely unthinkable. And at our organization, we feel that it completely turns back the clock for women's health care. I appreciate so much that you're out here, and we still have a lot of work to do, and I thank you so much.
Thank you.